The first time that I came on the wards during the outbreak of the COVID-19, I was so scared because it just brought back memories immediately. I was 28 years old, and when I had Ebola, it's still difficult for me because we lost people and they died of something that could have been prevented if we were well prepared. My name is Dr. Adaora Okoli. I'm a physician. I grew up in Nigeria, specifically in Lagos. If you don't work hard, you cannot survive in Lagos because it's very fast-paced and because we didn't have much of a very functional government. We had to work for a lot of the things that we have. My dad used to always say, as the only girl, you look good as a doctor, and this was as early as 5 years old. Looking around me, health was a major issue and still remains a major issue. So I wanted a career that would see me impacting the lives of others. I moved on to be a medical officer at a private hospital in Lagos, Nigeria. And that was during the period that we had the Ebola outbreak in West Africa. I remember that continuous medical education program on my birthday, 2014. It was a Saturday morning, and I went there around 9 o'clock, and we were talking about the Ebola outbreak in Liberia and how it crossed over to Sierra Leone. 5 to 9 out of 10 people who have Ebola would die of the disease. Now, that was very frightening. Patrick Sawyer was the first case of Ebola in Nigeria. He was found to be ill at the airport. He came from Liberia, a country that was already battling Ebola. We still were not as prepared mentally as when we first had that case. We didn't really have the personal protective equipment to use. We didn't have anything to protect our eyes with. We had just a normal surgical face mask. The patient, he was having fevers, diarrhea, vomiting, and we had to go in to check him at least every 6 hours. But I didn't realize that I had a cut on my hand. It was like a tiny laceration on the index finger of my right hand. That might have been an entry point for the virus. I didn't know that I was going into isolation until I got to the isolation center. My clothes were burned. I was there for 14 days, and it was 14 days of battling for my life. There was a point when I felt I might not survive. It's still difficult for me because we lost people who have family, people who were family to us, people who we saw every day, we spoke with every day, we laughed with, we ate with. We had fellowship with them, and they died of something that could have been prevented if we were well prepared. I'm currently an internal medicine resident, a physician. The first time that I came on the wards during the outbreak of the COVID-19 infection, I was so scared because it just brought back memories immediately. Having Ebola sort of prepares me to take care of my patients and gives me more of a perspective to fall back on, realizing that I had been infected when I didn't need to be infected. So if we don't have access to personal protective equipment, then we can't really do our jobs. Now I can decide that if there's no PPE, I can't see a patient. The thing about outbreaks of infectious diseases such as Ebola and COVID-19 is they really don't respect time. They don't respect governments. They don't respect people. They just spread, affecting a weak public health system. And it takes a lot of time and effort to build a public health system. You should look at other countries who have few resources and find out ways that you can possibly prevent the spread of infection in those countries that don't have enough doctors, countries that don't even have enough running water for their populations to wash their hands. There's some things that we can do in Europe and in North America that we can't do in Africa. You can't shut an entire city down for a long time. It's not going to be sustained because a lot of people depend on making money daily. We find ourselves in that cycle of calling for emergency fundraising for outbreaks, and then when it's all back to status quo, and then another outbreak crops up in the next 1 year, and then we're scrambling again, trying to raise funds for that outbreak, and it's the cycle that continues over and over again. So countries and governments have to really pay attention to emergency preparedness. And it's not just about outbreaks, it's about the people. It's about recognizing that health is a basic human right. The advice would be, listen early to public health experts when they sound the alarm. Remember that whatever happens in any part of the world can happen to you where you are. The world is more connected than we think.